Hello everyone, I'm Dr. Rosa Oliai, obstetrician and gynecologist from Gwalior, and I have my menopausal clinic practicing for the past 35 years. What I've noticed is a lot of women coming to clinic, majority of them, we treat as obstetricians. We come across reproductive health from adolescent towards their reproductive life, they are pregnant, infertility issues. What I feel most is that I realize majority of the women who are in the transition of menopause, they do not come to the clinic. We miss that category, and that's why it's very important for us as obstetricians to find out the reason why they do not come. It's not that they don't have symptoms. It's that they just don't know that there's a treatment and they should come to the gynecologist. Sometimes it's also cultural and psychological issues, because most women beyond the age of 45, because the transition is 45 to 50 years in India, they feel that it's part and parcel of their life and they just go away with it. They don't take it seriously. Most often the symptoms are very vague for them. They feel, having body pain, having a headache, having a little bit of irritability, joint pain, backache, not able to sleep is very natural, not realizing that these are the symptoms of going into the next phase, that's menopause. So we have to really counsel the patients, because most often these symptoms are treated as per symptom and they're not treated as a whole for menopausal issues. So when they come to us, we have to ask them certain questions in order to take out the symptoms, which is hidden, and that may be the most important part of their problems. Question could be very simple, from asking them, how is their sleep? How is their mood? Are they having any urinary problems? Are they able to sleep well at night without getting up going to urinate? How is their irritability and how would they function daytime? Are they socializing? Are they depressed? So through these questions that if we can ask them, we open a conversation, and that is very important in treating patients in menopausal age group. They have to be told that the transition before getting into menopause could be called premenopause, and that's very natural. However, being natural symptoms, they need to be taken care of, and there are very scientific good medications for it. So the initial symptoms that the patient comes is mostly vasomotor. So when you ask them, are you having hot flushes, feeling hot suddenly? And that leads to not being able to sleep. So one thing leads to the other. Not being to sleep at night makes them irritable the whole day. They're not able to function. That again causes problems for the heart. Metabolic syndrome later on in age, as they age further on. These are some of the complications that they should be told about. Cardiovascular diseases, diabetes, forgetfulness, psychological issues. So they should be counseled very well at the clinic. They should be able to speak out by asking them questions. And they should be reassured that this is natural, it happens, yet there is a treatment. And if they are not treated on time, these will be leading to more complications in their lifetime. I think as gynecologists, we need to develop the habit of patiently hearing to them and counseling them, because we have the knowledge, we have the clinics with us, we have the evidence-based medicine can help these people to recover. So it's just the symptoms which is there, but the treatment is very important, and has to be given to the patients. So as a whole, it's a holistic approach, is part and parcel of a good management at our clinics, and we must not let them be going away and miss the chance visiting us. Thank you.